Hi everyone, Jen Houston here from Integrative Medical of Rockford. I wanted to chat a little bit today with everything going on in the Rockford area with cold and flu season. So, we've definitely heard in the news lately, right, that COVID is on the increase in our area. And that has been frustrating for many, I know. But I wanted to kind of give you guys a picture of what we do here in the office for you if you were to get sick. So we know that you're doing everything right. We know this group that is following us here. You guys are eating well. You're washing your hands. You're taking vitamins. You're exercising. You're doing all of those things that are going to keep you healthy and help you fight any sort of illness that you do get. And really great job with that. Continue doing that. But with COVID on such an increase in the Rockford area, I think that even the slightest sniffle, the mildest headache, the, subtle cough makes us and the guy next to us at the grocery store, right, think that maybe we have COVID. And it's not always the case. There's a lot of other things, just like every other cold and flu season going around, a lot of rhinovirus, cold virus. There's, of course, the flu, there's strep throat. There's lots of things that any of those symptoms can be. And it's not always COVID. But what I wanted to reassure everyone is I wanted to kind of walk through what we do. So we've always, even prior to COVID in the medical offices and realm, we sanitize rooms. We clean rooms in between each patient. We're wiping down door handles. We wipe down our stethoscope. We wipe down the otoscope that we look in your ears with. So we're really, that is not new for us in the medical world. We have been doing that for decades, and we continue to do that throughout COVID now. But I just wanted to kind of mention those things, that's always been a thing that we do. Also, we're gonna be screening patients going forward. Anybody that calls with any sort of sick symptoms, an appointment will be made for you, but then you're going to be passed back to myself or Abby. And what we're going to do is we're going to talk to you about what symptoms you're having, what you're feeling. Do you have a fever? Do you have a cough? Do you have a sore throat? We're kind of going to decide what sort of risk it is to have you just come into the office, or if we're going to come out to you, to your car, and do a quick little swab out there to see what we think you might have. So we have the ability in 15 minutes time to know if you have strep throat, to know if you have influenza A or B, which is the flu, and also COVID. So any one of those things we can swab you for and know in 15 minutes if that's something that you have or not. The positive on that is we can do that, like I said, right out. You can sit in the safety of your car. We can quick swab you, come back out and tell you what you have. There's little caveats to that, depending on, exposure time and percentage of accuracy, depending on the exposure in that. But we can talk about all of that, at the appointment. The point that I wanted to really make is that we're not just going to have a lot of sick people necessarily in the office unless we feel like it is safe for our patients. We do ask that if you are not feeling well, to wear a mask. That has always been something in the medical world that we do. So that is certainly not new to COVID. If you do have a cough, I think ever since I've been a nurse practitioner or even a nurse, so 20 plus years, had people wear masks to decrease that risk to everybody around. I have even done well visits in minivans. So we are extremely flexible with what we can do to accommodate you to feel comfortable coming in, whether you're well or sick. So bottom line, we just really want you to feel comfortable and safe when you aren't feeling well, that you will be taken care of here, and that we'll be able to treat you and help you feel feel better, because really the treatment is so different for a cold as it would be for strep throat. So we really want to see those sick people to make sure that they get the right treatment and recommendations for what you can do to be on that road to recovery. So it's not always COVID. Sometimes is, not always, not most of the time. So we just want to make sure that you guys are comfortable. Call, ask lots of questions. We're here to talk to you too. And as always, stay healthy, and we'll see you soon. Bye.